Hi there, I'm Dr. Emily Porter in Austin, Texas, and I'm here today to talk about Peyronie's disease. It's kind of a difficult word to spell, but most people that come to me, they've Googled something and they know that they have it. So Peyronie's disease is caused by a plaque that usually forms in the membrane of the penis that interferes with its ability to expand when a man has an erection. Sometimes to the point that they have a pretty sharp bend, and it can cause the penis to become bent when it's erect. Sometimes it's a little bend, sometimes it's a long bend, sometimes it's more near to the person's body, sometimes it's more at the tip. It can be anywhere on the body, and it's frustrating because they don't really know exactly what causes it. It might be from trauma that you had. There's some associations with some diseases like Dupuytren's contracture, and there's lots of various things. It's not really well understood other than that it's very, very difficult to treat. There's not a lot of treatment options, and that it's incredibly frustrating for a man who's suffering, who has found out that he has this. We don't know how many people have Peyronie's disease. The estimates are anywhere from 1 to 23% of men, especially 50 and up. And that's just because it's underreported. Men are embarrassed. They now in the age of Google can look things up, and then maybe they just read that there's no hope and they don't ever see a doctor. But it's hard to think that 25% of men might be suffering from this condition and they just don't even bother seeing a doctor. So in the past, there's been some surgical treatments that worked, and a lot of them are painful. A lot of men don't even like the idea of having a surgery on their penis. It sounds horrible. A lot of them cause shortening of the penis, which I don't know a lot of men who want their penis to be shorter if they can avoid it. So they avoid that. They don't want the recovery. And they don't really always work. There's been some traction devices that you can put on, but unless you want it on 8 hours a day and you have to take it off every 20 minutes, it's not really very practical for most people. There's a medication called Xiaflex, which you can inject. A doctor injects. It's really, really, really expensive, and it has about 5 to 8% penile fracture risk. So somebody will actually end up having to have an implant as a result, and maybe they just had mild Peyronie. So a lot of men don't want to take that risk. That's 8% or 5% is 1 in 20. So 8% is a lot. So what we have is we have really novel approaches to treat Peyronie's disease. I've kind of made this my passion and my specialty. There's a lot of evidence-based medicine about shockwave therapy on the penis, especially over the plaques. There's a lot of studies on using platelet-rich plasma, which is your body's own blood spun down into growth factors to create an injury and stimulate healing stem cells to come and heal a problem. We can use penis pumps. I've started using lasers that we use on scars, because this really is kind of a scar. And we really evaluate you. We have an ultrasound in the office. We do a pretty thorough consultation. We take some pictures. We look at blood flow, and we take some pictures to see how severe the problem is. And then we figure out what's the best way to treat you. It's usually going to be a comprehensive treatment. It's something that's not going to be fixed in one visit generally, but we have had lots of success. I might not be able to help the man who has a 90-degree bend that he's had for 10 years, but for the man who has 20-degree bend that he's had for 2 years or 3 years, and he's having pain with erections, I can help those men quite a bit and become functional. That's really my goal, is to get somebody as functional as they can be, and I make it my passion to do everything that I can, and I don't give up easily. So I hate to see men suffer from Peyronie's. It is a horrible disease, especially that have so few treatment options. I see them being frustrated. I see their wives being frustrated. I see them cry in my office. A lot of them don't cry, but I cry. So I see how much it must hurt, or how much it must feel bad to know that you have something that you don't know what's caused by. You didn't do anything to cause it, and that you don't think you have any hope. So I love to help men. I love to help people get their lives back and be able to even be able to masturbate again. I have one gentleman that he was just by himself, but he couldn't even masturbate. So I can make that possible for him. That helped me a lot. So if you think I can help you, please reach out via our website or give us a call, and I'd love to see you in clinic.